This medication is used to treat bladder cancer. It is made from a specially prepared virus that carries a human gene, interferon alpha, into cells. This type of treatment is known as gene therapy. It is important to follow the recommended dosage and timing for this medication to ensure its effectiveness in treating bladder cancer. It is best to consult with your healthcare provider for the proper administration of this medication. Before starting this treatment, make sure to read the patient information leaflet from your pharmacist. This product is administered into the bladder through a tube by a healthcare professional, following your doctor's instructions, usually every 3 months. It is left in the bladder for 1 hour and then released by urinating. Your doctor may have you change positions every 15 minutes during this time to ensure the product reaches all parts of the bladder. It's important to disinfect the toilet bowl every time you urinate for the first 2 days after treatment, as small amounts of the virus may shed in the urine. Add half a cup of bleach to the toilet bowl before you urinate, and wait 15 minutes before flushing. Be sure to talk to your doctor about other important steps you can take to prevent infection. If you experience tiredness, urinary discharge, difficult/painful/frequent urination, or bladder spasms while using Adstiladrin 3x10exp11 VP/ml intravesical suspension, it's important to inform your doctor or pharmacist. This medication has been prescribed to you because your doctor believes that the benefits outweigh the potential risks of side effects. While many people using this medication do not experience serious side effects, it's crucial to seek medical attention if you notice pink/bloody urine, signs of infection, or symptoms of a serious allergic reaction such as rash, itching/swelling, severe dizziness, or trouble breathing. If you notice any other effects not listed here, make sure to contact your doctor or pharmacist. Before receiving nadofaragene furadinovec, it's important to let your doctor know if you have any allergies to it, interferon alpha, or any other allergies. This product may contain inactive ingredients that can cause allergic reactions, so it's crucial to discuss this with your pharmacist for more details. Before using this product, make sure to inform your doctor about your medical history, especially if you have immune system problems such as HIV or certain cancers like leukemia/lymphoma. If you are planning to have surgery, be sure to tell your doctor or dentist about all the products you are using, including prescription drugs, non-prescription drugs, and herbal products. If you are pregnant or planning to become pregnant, it's important to discuss this with your doctor. You should not become pregnant while using nadofaragene furadinovec, as it may harm an unborn baby. Your doctor should order a pregnancy test before you start this medication. Women using this medication should ask about reliable forms of birth control during treatment and for 6 months after the last dose. Men using this medication should ask about reliable forms of birth control during treatment and for 3 months after the last dose. If you or your partner becomes pregnant, talk to your doctor right away about the risks and benefits of this medication. It is not known if this product passes into breast milk, so it's important to consult your doctor before breastfeeding. It's important to be aware of potential interactions with other medications when using Adstiladrin 3x10exp11 VP/ml intravesical suspension. Be sure to keep a list of all the products you use, including prescription and non-prescription drugs, as well as herbal products, and share it with your doctor and pharmacist. It's crucial not to start, stop, or change the dosage of any medicines without your doctor's approval to avoid any potential risks or serious side effects. Always consult with your healthcare provider before making any changes to your medication regimen. If someone has taken too much Adstiladrin 3x10exp11 VP/ml intravesical suspension and is experiencing severe symptoms like losing consciousness or difficulty breathing, it's important to seek immediate medical help. In the U.S., you can call your local poison control center at 1-800-222-1222, and in Canada, you can call a provincial poison control center. During your treatment with Adstiladrin 3x10exp11 VP/ml intravesical suspension, it is important to have regular medical tests to monitor your triglyceride levels and blood sugar levels. It is essential to keep all your medical and lab appointments. Make sure to take each dose of Adstiladrin 3x10exp11 VP/ml intravesical suspension as prescribed by your doctor. If you happen to miss a dose, consult your doctor or pharmacist immediately to determine a new dosing schedule. This medication is typically given in a hospital or clinic setting, so you won't need to worry about storing it at home. It is used to treat certain bladder conditions and is administered directly into the bladder. The dosage and timing of administration will be determined by your healthcare provider based on your individual needs. Be sure to follow their instructions carefully. If you need more help, call your doctor for medical advice. In the US, you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.